Hey everyone! Today, we're going to tackle a topic that can feel, well, pretty overwhelming. How to find the right psychiatrist. If you're looking for that kind of expert mental health care, this is your guide to figuring it all out and getting the support you deserve.
And look, it is completely normal to feel a bit lost when you first start looking. I mean, the sheer number of options, the different kinds of professionals, it's a lot to take in. But don't you worry, the whole point of this is to break it all down into clear, manageable steps.
So that's what we're going to do. We're going to map this out together. Because this isn't about just finding any provider, it's about finding the right provider for you. Think of this as your personal roadmap to making a choice you can feel really good about. Let's get into it.
Okay, first things first. Before we can even begin to search, we need to get a really clear foundation. What exactly is a psychiatrist, and where do they fit in the grand scheme of mental health care? So, here is the most crucial thing to remember. A psychiatrist is a medical doctor, an MD. They've gone all the way through medical school and residency, which means they're uniquely trained to understand that really complex link between our physical bodies and our mental health. They're focused on the biology of it all.
Now, this right here clears up a super common point of confusion. A psychiatrist, as that medical doctor, can prescribe medication and order lab tests to see if something physical is going on. A therapist or a psychologist, on the other hand, is all about talk therapy, helping you work through your emotions and develop new coping skills. But here's the thing, it's not an either-or situation. A lot of people find that seeing both gives them the best of both worlds, tackling the problem from every angle. All right, so now we know what a psychiatrist does. The next big question is, how do you find the one that's a perfect match for you? This is where we get into the real, practical steps of the search.
Think of these 4 steps as your go-to checklist. First, check their credentials. Are they board certified? Do they have a specialty that fits what you need? Second, and this one is huge, how do you feel with them? You have to feel like you can be totally open with this person. Third, get practical. How do they handle things like after-hours calls or refills? And finally, think about whether seeing them in person might be better, since a lot can be communicated through body language.
And this really gets to the heart of it all. You know, beyond all the degrees and the fancy certifications, the real foundation for any good treatment is trust. It's got to be a partnership. Feeling safe enough to be completely honest is absolutely everything. So, you've done the hard part. You found someone, and you scheduled that first appointment. Now what? Well, a little bit of preparation can make that first meeting feel way less intimidating and a whole lot more productive. Think of this as your pre-appointment homework. If you can walk in with this stuff ready to go, your medical background, maybe a little log of your symptoms, a list of your meds, and a clear idea of your goals, it just helps the doctor get a full picture from day one. And please, don't forget that last one. A quick call to your insurance company can save you a major headache down the road.
So, what's that first meeting actually like? For the most part, it's a really detailed conversation. You can expect it to last for about an hour. The doctor's going to ask a lot of questions to really understand what's going on. They might even order some blood work, just to rule out any physical issues, like a thyroid problem, that could be causing your symptoms. This initial chat is the cornerstone for your entire treatment plan.
Okay, you've had your first visit, and a plan is starting to come together. So, let's talk about the journey ahead. What does long-term treatment and the path to wellness actually look like? It's helpful to know that there are different ways to approach care. Standard psychiatric care often centers on medication management in shorter 15 to 30-minute appointments. But then there's the multidisciplinary approach, which is much more holistic. It brings in therapists, social workers, and others to look at the biological, social, and psychological parts of your well-being, usually with longer appointments.
And this is just so important to remember. Clinical treatment, medication, these are incredibly powerful tools, but they work best when they're part of a bigger support system. Building that network of friends, family, or support groups, that's the stuff that really helps you stay stable in the long run.
So how often will you have to go? Well, in the beginning, when you and your doctor are trying to figure things out, you might meet every 2 to 4 weeks. But once you get into a good groove and things start to stabilize, those visits usually become less frequent, maybe once every 1 to 3 months.
When it's all said and done, this is the main takeaway. Your voice matters, your goals matter. This whole thing is a partnership. You're an active player in your own journey to wellness, working right alongside your provider to create a plan that works for you.
And so the final question is really for you. Taking that first step can feel like the hardest part, but honestly, it's also the most powerful. Finding the right clinical support is a huge piece of building the life you want to live. So are you ready to start?